And we have three great examples of big data at the edge today. The first one is called Thrive, Timely Health Indicators Using Remote Sensing and Innovation for the Vitality of the Environment. Prevention is better than the cure, they say, of course. So a timely alert could help prevent trips to the ER for the 25 million people who have asthma in this country. Perhaps the best modeling of air pollution ever done is something you're about to see. Has great possibilities for real-time mobile measurement of air pollution and alerts. It's something that we talked earlier about sharing. It's something that every community could benefit from, perhaps. So I'm thrilled to introduce David Laurie, at the University of Texas at Dallas. He's been assisted in this by York Eggleston from the Machine Data Learning. Please welcome David Laurie.
Well, I'm really excited to be with you today. What I'm going to show you is something I feel passionate about, and that's because I think we can make a real societal difference. So the paradigm here is we're going to bring together multiple relevant big data sets that address specific societal needs. So what I'm going to start by showing you is one of those key societal needs in the health area. And as was already mentioned, obviously prevention is better than cure, much better. So you might have seen this recent World Health Organization report that says in 2012, 7 million people on our planet died due to air quality related issues. That's a lot of people. And even if it's not such a drastic endpoint as dying, then there are 25 million people or more in the US that have asthma. Asthma has, among other things, environmental triggers, so knowing the levels of those environmental triggers is really important to give timely alerts. So to do that, we actually need to know what the atmospheric composition is at any time. And so to do that is a massive logistical exercise. So really what I'm showing you here is leveraging all the things we've just heard about, the high bandwidth to move around these big data sets. And you may wonder, how big am I talking about? Well, to do the application that I'm about to show you involved 40 terabytes of data from multiple sensors. So if we use the 10 megabit connection that we were just introduced to, that would have taken 185 days to just transfer that data. But if we were using the 1 gigabit connection that Glenn mentioned, that would be about a day and 21 hours, so a much reduced time. And every day, I'm doing this as an operational process, I have a 4 gigabyte data update, which with the 10 megabit connection would be 54 minutes, or with the 1 gigabit would be a mere 32 seconds. So you can see that this type of fast network is greatly going to facilitate such applications. But that's now. We're likely to be moving into a new era, which we're already seeing with the Internet of Things, with wearable sensors, that these applications that you're going to see a prototype now can go up to a whole new level, and there that will be involved with way higher data sets moving around. So the low latency, high bandwidth networks will be invaluable in making these applications really fly. So a second part of that is the two-way communication. So we probably normally don't think of ourselves as sensor networks, but if you take, for example, the asthma case, if you have a child that has asthma, he or she could be having their own personal sensor, which is not only valuable for them, but is also valuable to give neighborhood scale pollution measurements. So the network can again come in useful to communicate back the data from those mobile distributed sensors to be shared by the wider community. So really, the goal here, of which I'm showing you a first step, this is a vision that's been driving me for a long time, is really to have the big picture. We're in an exciting era where we've seen bioinformatics grow up and now come of age. We're sequencing whole genomes. We now have medical health records being an everyday thing. And also, we're very used to the weather forecasts every night. But we can take that to the next level if we, instead of having them in their separate silos, we bring them together. So that's really the driving force behind the example application I'm showing you, where we're teaming up with the Veterans Administration, which is pretty much the country's largest healthcare provider, and any other interested party, in fact. So, for example, across North Texas, there's a group of 80 hospitals involved with this. Also, Kaiser Permanente have expressed an interest. And this is not just specific to the United States. What I'm doing is global for the entire planet every day. So it could be just as well with our orange partners across Europe or in Japan or Korea, or right now China and India have significant air quality issues that is just as relevant there as it is here. So let me just give you a whirlwind backdrop so you can get to appreciate a bit more why this is significant. Airborne particulates, often known as PM2.5, are sometimes called the invisible killer. We don't realize the effect that they're having on us. So if we take the world as a village of 100 people, 32 of us are breathing significantly polluted air. So this is not some minor problem in a corner. It's actually a very prevalent issue. And now these pollutants I'm talking about are minuscule. On the left, you see a human hair. So a human hair is pretty small. It's not very wide. But one of these particles I'm talking about is so small, you could fit many of them across a human hair. So on the right-hand side, you see the diameter of one of these airborne particulates. So the PM2.5 really just stands for particulate matter of a size of less than 2.5 microns. So in the bottom, you can schematically see as those blue spheres, several of these across a human hair. Now, these are so small that when we breathe, they get past the filter hairs in our nose, down into our lungs, and then they're associated by a whole range of health effects. So this is just to give you an idea of the size here. On the right-hand side, you see a pollen grain, and on the left hand, a molecule. And so the black line marked PM2.5 is the size range of particles we're talking about. And if you do a literature review, this little incomprehensible table here is just a summary of the different health outcomes, from all causes of mortality to pulmonary effects, asthma, as we've mentioned, lung cancer, cardiovascular effects, even to blood markers and reproductive health like low birth weight. So this has had impact across a whole range of things. So you can begin to appreciate why this is a good starting place. Now, you'd think with something so important, surely we're measuring this everywhere. Unfortunately, that's not the case. The type of instruments used to make the measurements you can see in the bottom there. So even across the US, which has a pretty good network compared to the rest of the world, you maybe have 2 or 3 of these in a city, and there are large areas that don't have any monitors at all. So the map in the top there, the little red symbols, they're the locations of sites where I've used hourly data for the last more than a decade to make as part of this whole machine learning, multiple massive big data set approach. So that's more than 8,000 sites in more than 50 countries across the planet. I'm simultaneously using all of that as part of my system. The thing is, we want to know it everywhere. So you'll see a few slides later on that my product now gives me a daily global map at 10-kilometer resolution for the entire planet. So how do I do that? Sorry, I'm losing my microphone here. So I do that by comparing these observations, which I have at specific sites, but not everywhere, to things that are ubiquitously available. Now, that ubiquitously available data is coming from multiple satellites, from the meteorological conditions, from the population density. So I'm actually combining about 40 different big data sets to my in situ observations. And I'm doing that with very high time precision, because if I'm not really careful to compare apples to apples, I don't get good performance. So critical in this is bringing together the relevant data sets. So as I mentioned, we're really moving into an exciting new era where we're having that availability of data like we've never had before. So what are the data sets? This table just links a few of them. Sorry, I'm losing my microphone here. Lists a few of them. So these come from things like the population density, continual global monitoring with multiple satellite products, and the meteorology. So I use the machine learning to learn the mapping from what I want to know to those things I have available. And I learn the associated uncertainty with this. So not only do I provide an estimate, I provide an error bar, because it's always good to know our uncertainty. So once we've done that, and I've done this on a daily basis going back to August the 1st, 1997, and it's operating in a real-time system, we can then relate that to the health outcomes. But before we do that, I just want to give you an overview. So this is a map, the average map of more than 6,000 days of my global estimate between August the 1st, 1997 and the present. It's a rainbow scale with low depicted in the blue, red being in the high. So the low areas of pollution for airborne particulates are in blue, the very high areas are in red. So you see off the charts there in China, really high levels of pollution. And just to translate what that means to the individuals living there, a recent study estimated that the life expectancy in China, in northern China, was reduced by 5 years due to the use of the coal-fired power stations, which then led to much greater airborne particulates. Then next to the Aral Sea, you see a little hotspot there where the life expectancy is 27 years. And that's because those airborne particulates are not just any airborne particulates, they are laden with like terrorism type particulates, because that's where there was a Soviet weapons testing facility on an island. But then the water from around there in the Aral Sea was used by Uzbekistan for irrigation. The consequent result of that was the Aral Sea was almost drained, and that island was no longer an island, but was in the middle of like a windswept dust bowl. So if you happen to be just downwind of that, that dust is laden with materials like anthrax and so on. So that's a very extreme example, but nonetheless makes the point that what we breathe can have a dramatic effect on us. But then even in places close to home, like where I live in Texas, there are some regions where there have been a lot of low birth weight babies. Maybe that's actually associated with this. So this is not just something in someone else's backyard. It can be relevant to you and me, even more importantly, to our children. So knowing what these levels are can be really critical in giving timely alerts. So if you have asthma, for example, the difference between an ordinary day and a very bad day could be ending up in the ER. So a timely alert to make sure you have your inhaler could be the difference, for example, between those two extreme events. But then from the point of view of the health insurance companies, it's way better not to have to make that payout, just as it's better for the individual never to go to the ER. So there's a lot of merit in this approach. So we're integrating this with the Veterans Administration, and this basically shows you the workflow. We combine these multiple big data sets using machine learning to give the daily global estimates, so wherever the individuals are, we can have an estimate. And then we relate it to all emergency room admissions for absolutely every condition, all ICD codes, and also all prescriptions. So when you do that on a daily basis for 7 million people for more than a decade, you learn very well the environmental profiles that are related with individual conditions, whether it's COPD or asthma, obvious examples, with less obvious examples as well. We do it for every condition. So then that can be used as part of personalized apps, like for My Healthy Vet, which is the Veterans Administration tool for communicating with its veterans. Or to have smart Dr. Watson-type apps that the physicians might be using to help diagnose conditions, or to even look at staffing management. So if you are the manager of an ER or a walk-in clinic, it's really useful to have a heads up to say, given our current environmental situation, you are likely to expect this number of admissions of these kinds, and you need these supplies. That could reduce the waiting times, make sure you have everything in place, and altogether give a more optimum, cost-effective service. So you can see there are multiple verticals based on top of such a platform that is then very scalable to add to a whole range of new applications that I haven't even touched upon. But really, that's just the beginning. So this is One application, leveraging the next generation of high-speed networks that I've just described here for health applications. But then exactly the same paradigm we're also working on for fire and drought. Every year, the US spends between $1 and $2 billion just on fighting fires. That's not the property damage, that's not the insurance, this is just fighting the fires. So if we know where those fires are going to break out, it's so much more cost effective. So a great example of high bandwidth applications would be hyperspectral streaming of images from aerial vehicles such as this, and fire regions have a defined signature, hyperspectral signature, that can be used to get the crews in the right place before the fires break out. Likewise, we have 11 Western states that have recently declared drought declarations, and so we can use exactly the same type of approach for optimum irrigation and water usage. So what you see here is a snapshot on an iPad where we've used the remote sensing from a satellite more than 600 kilometers in orbit to look at the university campus, and you see the color scale there. Red is a lot of chlorophyll, blue is no chlorophyll. So you can see the playing fields, the sports fields there show up as there's a lot of chlorophyll there for the irrigation. But when I showed the grounds manager this, he got really excited because from space you could see where one of his valves had burst and flooded the field. So that kind of heads up is really significant for all kinds of things. So I think I'm going to finish there, but I hope you get a sense of the excitement why these things are really societally relevant and can help us build the next generation of applications to make our lives better, to be more cost effective, and just to take things to a whole new level. So thank you.